Hi, my name is Ronald Wagner, and my topic is drug abuse, more specifically education and awareness about drug abuse and how we can help. Let's get started. So the issue is the heroin and opioid problem has become an epidemic in Alaska, as many of us know. There's an episode of Drugs Inc. entirely dedicated to the Alaskan heroin epidemic, entitled The Alaskan Heroin Rush. This just highlights how bad the problem really is when there's a major national television show dedicated to the issue of National Geographic, which is nationally and probably globally known. Much of the heroin problem comes from the overprescribing of opioids. So according to DoSomething.org, more teens die from prescription drugs than heroin and cocaine combined. It's obviously a very bad issue that needs to be addressed. So those who are affected are obviously the people who are at the highest risk for abusing drugs. Drug use is popular amongst younger adults and teens or adolescents, and they are affected the most by far, and so they're the main target of this campaign and project. Drug abuse is also a major problem in rural Alaska as well, mainly because they don't have a lot of information about it or exposure to it, so they don't really understand a lot of the issue, basically, which also highlights how those who know little about drug abuse are affected a lot. So if you look at the graph above, it just shows the age groups and drug abuse, and how prevalent it is among the age groups, and it's definitely the most prevalent among 16 to 17 year olds, as you can see, and it starts to taper off after that, but it's still the most from 16 to about 20 years old, and then it's even more at 14 to 15 than it is from 21 to 25, so after about 20 it starts to taper off, and it doesn't really start to become too big of an issue until after 13. So some risk factors and protectors from drugabuse.gov. Many people who abuse drugs are young. They don't know a lot about the potential risks of abusing the said drug. They kind of just know, they hear the social positives, the party things about it, the good things about it. They don't hear any of the negatives. And they can be, life-threatening and cause a lot of medical issues and issues in their life socially and with their family and whatnot. So drug abuse is a very complex and multifaceted problem. There are many known risk factors though, but it's different for everyone. So if you look at the table below, drugabuse.gov has listed some of the risk factors and protectors. Some of the risk factors include early aggressive behavior, lack of parental supervision, substance abuse from peers or family members or people around them, obviously. If they see it, they're going to pick up on it. Drug availability, poverty also. It shows some domains and possible places that could happen. And then some protective factors. Some of them being, self-control, obviously. Parental monitoring, that helps prevent drug abuse. Academic competence, I think that goes hand in hand with education and awareness of the individual. Anti-drug abuse policies, depending on how effective they are and if they're implemented well and enforced well and everything like that. And also strong neighborhood attachment. That's just more good role models in their life, essentially, will help them with that. So some solutions for drug abuse and how this campaign can help and how it hopefully will help. School presentations, parent seminars, how to talk to your kids, what to tell them, how to educate them, educate yourself, things like that. Things to get the community involved, neighborhood events that are informational for the kids and the parents, and just the community, neighborhoods in general. Strong neighborhoods obviously help. Counseling support help. Teens can go through a lot of depression and things like that, and the counseling can really help with the drug abuse. To get a lot of the psychological and just everyday stress factors down and to deal with that, therapy kind of thing like that. So education and awareness are the keys. DoSomething.org states that teens who consistently learn about the risk of drug abuse from their parents are up to 50% less likely to use drugs than those who don't. So education does play a huge role in preventing drug abuse, or at least letting them know the risks of their actions. But it also prevents it 50%, according to DoSomething.org. So other solutions include taking advantage of the known previously stated risk factors and encouraging the protective factors while limiting the risk factors, obviously. However we can do that. These are just some examples of how to potentially do so. Teaching the teens self-control skills, their parents' parenting skills, helping the teens succeed, whether it be through policies, rules, role models, help, anything. Rules in the house, rules in the school, implementing good policies in society, good campaigns, healthy life decisions, everything like that. So some potential partners and ideas: getting Alaska Dispatch News to highlight the issue, as they do with many things that are big issues, and obviously this having a TV show dedicated to it and everything, it's a big issue that I think ADN could cover, and bringing a lot of publicity to the campaign and topic project, everything, for $2,000 grant. I think we could do that. The Anchorage School District, or just like an Alaska School Board, or maybe all of the Alaska school districts, if they could get involved, that would help a lot. Allow us to come and do some presentations. Possibly the Alaska State Troopers could even be a part of those presentations. I think they would be good, since they deal with drug abuse a lot on the enforcement side mainly. Some counselors would be good to bring into, a therapist, potentially, addiction specialists, maybe even pharmacists. I work in a pharmacy. We see drug abuse a lot and deal with that. There's an advisory board on alcoholism and drug abuse in Alaska. It's also kind of attached to the Alaska Mental Health Board. They could definitely be a huge partner. They deal with it a lot, and they could bring a lot of good information into the presentations and events. And also, University of Alaska Anchorage, obviously college students are at risk, as well as other high schoolers and things like that, which is why ASD would be good, and UAA for the same reasons, but for college kids. And also there's a lot of programs that have a lot of good information that could bring a lot to the table. And there's my references.